Hi everybody, welcome to Healthline. I am Gregory Zarian. Okay, so summer's here. So that means we invite you, as we always do, to get up, get out, spend more time with your family and friends, go on a swim, go hiking, just be outside. With the world being so different, we live by Zoom meetings, we live on our phone, on our iPads. We are still reacclimating as to how to be together. That does not mean you do not get your exercise on, your health on. As we always do here, we want you to be as healthy as you possibly can be. So make me a promise. You will spend a lot more time outside. You'll turn off your computer, even if you have to be inside. You'll do 20 jumping jacks. You'll drink more water. You are in control of your health. So make me proud, make you proud, and together we can just go through all of this in a healthier manner. The conversation is one we've had quite a few times before on the show. It's really important to me because I feel the more information you have that I give you, you can then pass on to family and friends and loved ones. And also ask important questions to your parents, to your grandparents, to relatives. The conversation today is all about strokes. And in 2020, there was 1 in 6 deaths from stroke contributed to cardiovascular disease. Every 40 seconds, someone in the United States has a stroke. They don't seem bad, but they're not great statistics. So to give us a lot more information on what we need to know about stroke is stroke neurologist, Dr. Artin Minaeian, who has been here before. How are you, doctor?
Very good, thank you. Thanks for having me, Gregory.
Thank you for coming back.
Of course.
Since you were here last, a couple years ago, to where we are now, is stroke on the climb up, on the climb down, or we're still in the same area due to health and wellness and what we know?
That's a very good question, actually. The numbers are on the rise, and the reason for that is actually is because of programs and channels such as Healthline that you have created that brings awareness to the communities, such as our own community here in Glendale. And because of that, patients are actually more aware of the disease process, the actual symptoms of the disease, the actual diagnostic imaging, and the treatment. And because of all of that put together, patients are actually presenting to the emergency departments. So if you look at the data in the past few years, the number of incidence and prevalence of stroke is actually on the rise.
But it's on the rise for more information that we are giving out to people.
And as well as, there's, lifestyle modifications that, are not being done, or treatments that are not being received. But that's always been sort of steady. But because of the awareness, I would say more people are presenting to the nearest emergency department.
That's awesome. More Dr. Minaeian when we come back. Don't go away. Welcome back to Healthline. I am Gregory Zarian. Joining us from Adventist Health Glendale is Dr. Artin Minaeian, stroke neurologist. Doc, I just want to address this really quick, Doctor. You said that cases were on the upswing. Mm-hmm. Does a lot of that have to do with COVID as well?
Of course. When we first started knowing about the COVID situation, we didn't realize why the numbers were rising also since the beginning of COVID. But there's a lot of data that's coming out nowadays, and it has been for the past year and a half. COVID creates a situation in the body that we call hypercoagulable state. It basically, in layman terms, it creates a thicker blood. The thicker blood can be traveling from the heart, for example. It can create a blood clot, and then that blood clot can travel to the brain and block an artery, and therefore cause a stroke. Same clot can cause issues.
Other things in the body.
Yeah, exactly. So I would probably contribute some of the rise also, or the higher incidences, because of COVID as well.
And because COVID is so new, we're still
learning.
We're still uncovering
more
information about it.
Sure.
Before we dive into what strokes are and everything, can you give us some of your medical background?
Definitely. Went to St. George's University. Did my training in New York Medical College for neurology, which took about 4 years. After that, moved up to Worcester, Massachusetts, for stroke fellowship training. Then came back down to New York City, practiced there for about a year and a half, and then moved back home to Glendale. And I've been here since 2014-15, and been practicing at Glendale Adventist Hospital.
What is it about neurology and strokes that intrigued you?
It's just a fascinating field, first of all. Second of all, it's a growing field. And finally, since the beginning of my training in 2009, or even before that, it's been 10, 15 years now, I've seen what's been always bothering me about is the rate of disability and death with stroke. In my mind, I always see stroke having three outcomes. Either a patient walks out of the hospital fully recovered, or they have some disability, or unfortunately,
they don't make it.
They don't make it, yeah, death. And because of this death part and the disability part, it's been bothering me. And throughout my entire 15 years, I've seen actually the rate of death actually drop from, it was third leading cause of death, and then it went to fourth, and then fifth. But unfortunately, the disability part stays up there on the list. And that's exactly why I give these sort of talks, to at least make our own community and patients more aware of this, so that because we have a saying, it's called that says time lost is brain lost. So the sooner you present to the emergency department, the sooner we can start doing our job by providing treatment and whatnot. And the data has shown that patients actually do much better and walk out of the hospital with lesser disability.
Because most people don't realize that when someone is suffering from a stroke, brain cells are dying every second.
Exactly. I think there's data that about 2 million cells per minute are dying from after a stroke. So the sooner you get yourself to the hospital, the lesser disability you're going to walk out with.
And one thing that I want to say to everyone, and we've talked about it before, find out where your closest stroke center is. Adventist Glendale is a certified stroke center. Know how to get there, know where that is. If you do not live in this community, find out where the closest stroke center is for you. In your wallet or in your purse, have a list of what your medications are, who your nearest relative is, or your husband, your partner, your brother or your sister, so they can get a phone call. If you or someone you love is suffering from a stroke, do not get in the car and drive yourself. These are easy, simple solutions in case you think or feel you or someone you love is suffering from a stroke.
Exactly. I really wanted to actually touch up on that, and people wonder why they should call 911 versus driving in themselves. When you call 911, when the paramedic arrives there, obviously that's their job. These guys are very well trained in picking out a stroke and signs and symptoms of it, and then they call the hospital. Once the hospital is aware, the operator sends out this massive number of texts. Back in the day, we used to have the pagers. But
I still have my pager.
You do?
I do.
Yeah, I mean, I kept it as a souvenir. I'm not using it, but we get this text. It says stroke. Neurologist gets it. Neurosurgeon gets the same text. Interventional neurologist gets it. Emergency doctor, radiologist, radiology tech, stroke coordinators, many people, 10, 15, 20 people receive the text that says stroke, and we're all ready to actually act on this. And it goes back to the same thing, time lost is brain lost. So if we know 10 minutes later a patient is arriving, we're prepared to do what we need to be doing.
Which I love, and here's the thing, if you think you're suffering from a stroke and you get in the car and drive yourself, you're not guaranteed that you're going to find parking. So as the doctor said, call 911. And if you are suffering from a stroke, once you get to Adventist Health Glendale, they are ready, willing, and waiting for you. More Dr. Minaeian when we come back. Don't go away. Welcome back. Joining us from Adventist Health Glendale is stroke neurologist Dr. Artin Minaeian. And Doctor, during our last segment, I said certified stroke center. You shared with me it's a comprehensive stroke center.
Exactly.
What is the difference?
There's medical treatment, and then there's surgical treatments in the majority of the fields of medicine. In a primary stroke center, we're only able to administer the blood thinning medication, which is called TPA or TNK. And unfortunately, they're unable to perform some of the procedures such as thrombectomy, pulling out the clot and whatnot. The centers that have these capabilities, such as Adventist Health Glendale, are DNV certified as comprehensive stroke center, have capabilities of administering the medical treatment, the medication, have the capabilities of of doing procedures, such as thrombectomy and taking out the clot, and we have ICU capabilities. And the entire team, it's a teamwork with the nursing staff, and ICU being able to handle this sort of patients post-surgically is what makes a hospital a comprehensive stroke.
And then you also have physical therapy.
Of course, yeah. Afterwards, patient gets downgraded to regular floor, which we have a neurology floor. We call it NTU, and these nurses are trained specifically to treat neurological patients, specifically stroke patients. And then after that, we have the physical therapists and rehab on site.
I love that, on the campus.
Yep,
so let's start with basics, doctor. What is a stroke?
Sure.
Because I know there's two types of stroke.
There are two major, exactly. So the stroke world is divided into two major branches, and it depends if think of it as either a blockage or bursting of a vessel or artery or vein. So we call the blocked type of strokes ischemic strokes. So if a vessel is blocked by a blood clot, blood cannot go through, therefore the area or the tissue beyond that point strokes out basically. The cells die in a sense. And then the other type of stroke is called hemorrhagic stroke, which another term is bleeding type of strokes basically, is when a blood vessel ruptures and the blood is just gushing out. Those are the gist of the two main type of strokes.
Are strokes hereditary?
A minor percentage of strokes can be hereditary, yes.
So that just means, and for those of you that may not know what that means, that just means talk to your parents, talk to your grandparents, just see if there's a history of strokes, ischemic or hemorrhagic, in your family.
Exactly, yes. And it's very important to know because it actually tells me what type of treatment I need to be using. For example, the aspirins and the Plavix you've heard, that will not do it for for a certain type of, certain other type of a stroke, such as genetic ones, for example, have the hypercoagulable state, which is thicker blood, and we need to be taking out our stronger guns than the aspirin and the Plavix is. So it actually, it's a very important thing to know.
But then that also goes back to what type of medication you're taking, what kind of, like have an information card in your wallet, in your purse, close, so then you as your doctor can then know exactly what you're dealing with.
Exactly, yes.
Doctor, what is a TIA?
So it's a term that we use that has the same signs and symptoms of a stroke, but the symptoms go away within minutes, hours, or days, and there's no mark left on the MRI. And why do we use that term? It's sort of a vague term in a sense that patients are like, why did you label me? When they come back to our offices a couple of months later, they're like, why did you label me as TIA? It's important to know that because the signs and symptoms were telling me that the patient may have had a stroke, but he or she recovered from it. But 15 to 40% of TIA patients have a chance or risk of having a stroke down the line. So it's very important to start, knowing that the patient may have had a TIA so that we start working on the risk factors and modify the risk factors so that, God forbid, they don't suffer a stroke down the line.
We're going to talk about the risk factors in a second. How does one recognize a stroke, signs and symptoms?
Sure.
And are they the same for men and women?
The answer to the second part, yes.
Okay.
The answer to the first part, the best mnemonic that the CDC uses and the American Stroke Association, everybody else uses, the EMS folks actually uses, and I've seen it in the restaurants everywhere, I see it nowadays, which I didn't see 5 years ago. Even 5 years ago, I wouldn't see this. It's called B fast. B stands for balance. Stroke patients can have balance issues. They can be swaying to one side. They can be falling down.
And it happens out of the blue.
Yeah, stroke is sudden. That's what tells me that it is a stroke versus other, unfortunate diseases such as multiple sclerosis, for example. It's a gradual thing that builds up within a few days or a few weeks or something like that. But strokes happen quick. And it's very good to know the mnemonic BFAST. B, again, stands for balance. Stroke patients can have balance issues. E stands for eyes. If it's a large vessel occlusion, blockage, it creates a larger stroke beyond it. And stroke patients can have gaze deviation, basically. So their eyes are looking to one side, for example. Another type of visual issue that they can have is they cannot see a part of their visual field, for example. They'll tell you, "Doc, I'm unable to see my left side." So that's for E's for eyes.
Okay, we're going to hold it right there. Hold on. Okay, so we got the B and B fast. We're going to finish the fast when we come back. Don't go away. Welcome back. Joining us is Dr. Artin Minaeian from Adventist Health Glendale. So, doctor, we were talking about stroke, and it is B fast. What is the fast for?
Sure. F stands for face. It's very easy to recognize stroke patients, unfortunately, have a droopy face or mouth. A for arm or leg, actually. And the easiest test that we actually administer down in the ED or anywhere else, we tell them to hold your arms out, close your eyes, and keep them up for 5 to 10 seconds. And you can even pick up some subtle weaknesses, what we call drifting. So the arm starts doing that. And that's for subtle weaknesses. But obviously, if it's paralyzed, it's paralyzed. S is for speech. Stroke patients can have slurring of speech. They can have problems coming up with words, or they can have difficulty understanding even speech. And T stands for time. This is the reason we're doing this sort of talks, basically. T stands for time. Time lost is brain loss. Call 911. Do not hesitate. As soon as you see one of the symptoms of the BFAST, you got to pick up the phone and call 911 so that the EMS can arrive and take you to the hospital.
Reversible and irreversible risk factors.
Sure.
Share with us what that is.
Sure.
What those are.
Exactly. So the risk factors are what causes the stroke, and we divide it into reversible and irreversible forms. The irreversible ones are age, race, genetics, previous stroke. Those, unfortunately, you cannot, as a doctor.
Those are facts.
Those are facts. Yeah, I cannot change them. I cannot do anything about them, unfortunately. What I can do to help the patient are the reversible causes. And those are, hypertension, high blood pressure remains to be the #1 cause of stroke. Cholesterol issues, diabetes, and the uncontrolled forms of these are what we're talking about. So if a patient, ends up having a stroke, we try to modify these risk factors. Atrial fibrillation, colloquially known as AFib or atrial flutter, AF flutter. Those are some of the risk factors. And then you have the lifestyle issues of smoking.
Can you say that again? Lifestyle issues of?
Smoking.
You know who we're talking. You know we're talking to you. And here's the thing. I smoked 2 packs a day for 20 years. When people say, "Oh, I can't quit," yes, you can. It's a choice. Every time you pick up a cigarette, you can choose to not pick up a cigarette. It's not the easiest thing in the world. It is the hardest addiction to quit, because I've been there. Choose you over that cigarette. Please continue.
Exactly. No, it's a very tough one, but it is possible, as you said. I have so many patients that tell me, they should have quit, or they could have quit before the stroke, because majority of them do quit after the stroke. So why couldn't they do it earlier is what aggravates me at times. But smoking, drinking, and inactivity are some of the reversible forms of risk factors. And my livelihood is on this. When patients come to my office, I start looking at all of these reversible causes to see which one I can fix. Sleep, lack of sleep, sleep apnea is another risk factor.
And here's the thing too, a lot of, with every excuse is a solution. So if you come into the doctor's office and he shares with you these healthy lifestyle choices and you don't do them, you're going to wake up one day and possibly suffer from a stroke or something else. And it shouldn't be a surprise because you were given this great bit of information to make life choices to be here as long as possible.
Exactly.
Doctor, acute treatment of stroke and different options. What are those and how are they?
Definitely.
And tell us the ones that are available.
Exactly. So we only have a window to administer a medication called TNK, which not many hospitals do, and they administer TPA. We used to administer TPA, but at Venice Health Glendale, we administer TNK now. Very similar medication to the TPA, but it's probably the strongest the strongest blood thinner in the hospital. It can dissolve clots that are causing the strokes. We only have about 4.5 hours to administer this medication. And obviously there's some contraindications of age and some other conditions that if you have those, we cannot administer it. For example, if you're on a blood thinner, Xarelto or Eliquis, you know, all these heavy-duty anticoagulants, we cannot use the medication. But we only have 4.5 hours to administer this medication. So the sooner you arrive to the hospital, if you arrive within this 4.5 hours, I can do that. If you arrive after 4.5 hours, you pretty much forfeit one option, which is called the medical treatment. After that, 4.5 hours, nowadays we do have the option of what's called thrombectomy, taking out the clot basically. That's a procedure that neurosurgeons and neurointerventionists perform. It's basically going through the groin, any large artery, with catheters and wires. You go up the vasculature, and under fluoroscopy, which is X-rays, and you approach the blood clot, and you can actually suction it out. And there's other methods of taking the clot out with stents and whatnot nowadays. Very good procedure. We've had very good success with this. We have 2 great proceduralists in our hospital that perform this. And that procedure can be done many hours after the 4.5 hours, but that's not to say that you can present anytime. The sooner you present, you may be able to even receive both the medical treatment and the surgical treatment.
Doctor, in 5 seconds, what's the one thing we need to know about how to not end up in your emergency room suffering from a stroke?
Lifestyle modifications, exercise and diet, so you don't get to end up taking pills.
And it's not that we don't want to see you, we just don't want to see you there.
Yes.
Thank you so much for coming back.
Of course.
So you heard it from Dr. Minaeian. It's in your hands. Ask questions, pay attention, talk to your family and friends. Remember, be fast. And also don't Google what you think something is. Call your doctor. They are there for you. Remember, the most important conversation you are going to have is about you and your health. So start talking. Thank you for joining us. We'll see you next time.
Thank you.